Hello, everyone. Welcome back to Dot Health. Today, I have a very special guest speaker with me, Dr. Alistair, who is a psychologist all the way from Howick, KwaZulu-Natal. He has been in private practice for more than 15 years. And based on his own experience of irritable bowel syndrome and a fluctuating mood, it drove him to delve deeper into the underlying causes of these common problems. This has led him to focus less on symptoms and diagnosis with clients and to give more attention to the possible causes of mental health difficulties. Alistair has come to understand that optimal brain and nervous system functioning is the foundation of vibrant emotional health, a sharp mind, and a healthy life free of physical complaints. So welcome, Dr. Alistair.
Thanks very much.
So all patients are different, but what are some common ailments that you often notice in men specifically, and how would you approach these?
So, of course, it's probably a generalization, but a lot of men really struggle to express what they're feeling, and it doesn't mean that they're not struggling with anxiety or a really low mood. It just means they haven't expressed it. And often that is because it's partly an emotional avoidance thing. And men especially, are known to distract themselves through their work. And that's a brilliant way to avoid your emotions and feelings. But so that's I think just absolutely key, especially with men. I mean, there are plenty of women who also struggle to put into words what they're feeling. Men especially really battle, and because they don't express their emotions to anyone, it means that psychological material just goes unprocessed. It's never worked through. Psychological or emotional issues are never resolved. So that's big for us guys.
Absolutely. Oh, I love that. And which DNA test kits do you use in your practice, and which patients would benefit from these?
So I suppose my top three are the DNA Health, the DNA Mind, and the DNA Resilience. DNA Health, because it just gives you a really nice overview of some key biological areas of functioning. So it looks at your susceptibility, your predisposition to inflammation and inflammatory processes. It looks at your detoxification capabilities, as it were. It looks at methylation. It looks at a really key set of biological processes that we now know can have a huge and profound impact on brain functioning. And as you said in my intro, my belief, and this is based on research, my belief is very much that if our brain is not working optimally, and that alongside our nervous system in general, our brain and nervous system are not operating at an optimal level, we just cannot expect optimal emotional health. We can't expect optimal psychological health either. So DNA Health for me is a really useful one. DNA Mind looks at three areas. Looks at neurodegeneration, so your susceptibility to neurodegeneration as you age. It looks at addictive behaviors, so the genes that are involved in, say, eating disorders, in substance abuse especially, and that's very useful. And it also looks at the genes involved in mood regulation, as well as anxiety-related issues. And to be able to say quite clearly, you have a susceptibility to, neurodegeneration or mood disorder or whatever it might be, that's very useful for individuals to hear, because there are very definite things you can do to lower that vulnerability.
Absolutely.
And with regards to DNA resilience, I mean, that's also another lovely test that looks at those molecular areas that underpin our resilience. So it looks at those genes involved in the biological processes involved in focus, in memory, confidence, persistence of, in tasks, optimism. It looks at all of that. So yeah, those are my top three.
I love, and there's more than 10 different types of DNA tests, so it's so difficult to choose, but
it is, yeah.
It's amazing. I always say to people, it's the passport to your body for life.
For sure, yeah. And you have to understand, if you do the DNA testing, you are taking an incredibly important first step, Of course, it's just a first step. There are going to be possibly a number of changes, lifestyle changes especially, that are going to be suggested. And I spend quite a lot of time with my clients looking at diet, looking at exercise, looking at sleep hygiene, looking at interpersonal relationships, because those impact on brain health and on the functioning of our minds.
Absolutely, exactly. It's not just about sleep or how you process information. It's your environment, everything. Diet, it all plays a role. I love that you incorporate all of that in. And then lastly, what is the top tip that you'd like to share with all men specific around mental health?
Sure. It's a good question. And it's so difficult to narrow things down. I think I would go back to this idea, and again, supported very firmly in research, that brain health and the health of our nervous system, so not just central nervous system, but the peripheral nervous system, the health of that is actually set in our early years of life. So often it's set during those very formative first months, first 3 or 4 years. But it's our nervous system is being set, it's being wired, either for resilience, for emotional health, or not. And of course that exists on a continuum. But for men, just to bear in mind that if you're struggling, with anxiety, especially with depression or a mood-related disorder, the root cause might actually be in your nervous system rather than in what you're thinking. And if we can look at how your nervous system has been set, and it's quite possible to do that, during therapeutic interactions, if we can look at your nervous system, we might uncover the root cause of these more psychological issues. So it's not to fall into the trap of going, sure, I just can't deal with anxiety and I don't want people to think I'm weak. Well, actually, it's possible you can't deal with anxiety because your nervous system has not been set in an optimal way. And that is because of how you were raised, perhaps, and or because of early life experiences.
Yeah.
So it's ask for help. Speak to a psychologist. Begin exploring these parts of yourself that perhaps you've never really looked at or considered.
Thank you. Thank you so much. It's been so insightful. I hope that everybody can benefit from this, specifically men. And yeah, we just appreciate all your time. Thank you so much.
It's been a real pleasure.